my practice, I find making a connection with a patient is way more important than the technology. And so I like to sit down with my patients and kind of go over what their expectations are and to give them a basic bottom line from A to Z of all the different technologies. So I like to start with the basics. I first learned about CoolSculpting a few years ago, and what that is a very simple approach to fat. And it sounded way too good to be true because since I've been a teenager, everyone was looking for a way to lose fat without putting in the effort. Because as we know, as mature adults, the most important way to keep fat off is by limiting our caloric intake and increasing our exercise or caloric output. So everyone knows that, and everyone does try to have a healthy lifestyle, but sometimes we just get in a rut, or sometimes we just have a problem area that doesn't respond to the basic theory of physics. So here comes CoolSculpting. Oh, you can freeze my fat without me doing any effort. Sounds great. Couldn't believe it. So I went back and actually contacted the company to see if they could set up a demonstration in my office, and I was my first patient. And you can see from my before and after results that without dieting and doing this at the worst time of year, Thanksgiving in New Orleans, I had a pretty dramatic result that even I couldn't believe, because it happens so gradually that you don't really notice on a day-to-day basis. But when you do the 3-month before and after, my result was quite dramatic. Seeing is believing. I don't like to offer anything to my patients, no matter what the price, what the cost savings are, unless I know it's effective and it's safe. So I incorporate it into my practice. And I love it because the patient walks in, you attach the fat source, whatever area they want to have treated, to the fat freezing machine, which I like to describe for women who can understand this. It's almost like a mammogram of your fat. So basically the fat section to be treated has to be able to be pinched in a machine like a mammogram and sucked into this machine for 1 hour. That 1 hour is a little uncomfortable at first when it grabs your fat, but pretty quickly the freezing action of the machine numbs up the area, so you're pretty comfortable for an hour. And the only restriction is you do have to be attached to the machine for that full hour for every area of fat that you would like to have done. You can pretty much expect a 20 to 30% reduction of the fat layer per treatment. So it's ideal for upper abdomen, lower abdomen. So that would be 1 hour upper, 1 hour lower. And then sometimes we add the flanks. It's about an hour for one flank, an hour for the other flank. So that would be 4 hours, but it can be easily separated anytime. Lunch hour, after work, anything that's convenient for the patient, because again, there's no medication, no IV. Just walk in, attach yourself to the CoolSculpting, and be done in an hour. There are some medi-spas that offer this, but beware, because if they have that machine, they may want to try to use it on people that maybe not be the best candidate, because the best candidates are people that have a localized area of fat that can be grabbed by the machine, but have good skin tone so that once the fat is frozen, the skin doesn't sag. At a woman plastic surgeon is we can go from the very simple to the very complex. Being a board-certified plastic surgeon in practice for 23 years with an excellent record of safety and efficacy and patient satisfaction, we can be very confident that we can offer something for everyone. Versus a medi-spa that might only have one machine and try to adapt that to every body type, doesn't really work, and then they come to us to fix it. Because you don't want to use the wrong technology, even if it's a bit cheaper, if it's not going to achieve the patient's desire.